I have a general question about stuff. Back home for a couple of years when I was going to school, I worked in a blood bank.
Oh, okay.
Blood banking.
Yeah.
Is there a decent blood banking system in Nicaragua?
So you will not believe this, but during the neoliberal years, there was no blood bank. And so if you were a patient in a hospital and you wanted care, you had to bring someone with you who could donate blood for you. They wouldn't give you blood unless someone was going to put the blood back. Yeah, exactly. So, I mean, it wouldn't have to be the same blood type, but it was like, we're not giving that person any blood unless you give us some. So, and you had to pay for, patients had to pay for sutures. You had to pay for, if you needed surgery, you had to bring the scalpel with you. Like, there was nothing in the public system. And this is why people died, because there was nothing in the system. And everyone, yesterday at CNFED, they were talking about the mentality that people have of it was everyone for themselves kind of mentality. Well, during the neoliberal years, there was this real, healthcare is such a fundamental thing, and when your family doesn't have access to health care, that is the thing that scares you the most. You need access to food and you need access to health care. And so when your family got sick, the way that you looked after them was running around and raising as much money as you could to take them to a private care, because that was the only way they were going to survive, was private care. And of course, private care thrived off of that, and the neoliberals in charge of the government were the ones who were promoting private care, and leaving the public system to languish. Talking with healthcare workers who worked, during the neoliberal years is quite moving. They were just doing anything they could to save lives, and people would show up and they would say, I can't even examine you, I don't have gloves, I don't have aspirin, I can't do anything for you. And that is very, very difficult for a healthcare provider to do. They would take people to the hospital in their own vehicles because they didn't have ambulances, just trying to save someone's life. So now it has been, and it continues to be a struggle for people to believe in the public system. Their experiences play that out. Anyone who's been, and had any depth of care in the public system, will say, that hospital saved my life. That's a great hospital. Those are great people at that place. But there still is a mentality that the best care you can provide for someone is private care. I'll just give you a quick example. We've got a patient right now who probably has MS and was never diagnosed. She's 24 years old. She was in our youth group, and she was not looked after. At one point, she had an incident. We helped her get to the hospital to get some neurological testing, but then her family never followed up on it. And her parents don't read and write. She lives in an extremely vulnerable situation, and she eventually lost the ability to walk, and her family were not moving her frequently enough. She got bed sores on her back. So they began to get concerned and wanted to take her to find out what she had, why she couldn't walk. And they paid for an insurance at a private care place so that she could be seen in a private center. It's all available in the public system, but they paid for the insurance so they could take her to the private care. And then by the time they got her to the private care, her bed sores were so bad they couldn't do the tests they needed because she wasn't in good condition. And she's now in the ICU at that hospital dying. She will die because her bed sores got to a point where her skin doesn't function anymore. It's a non-functioning organ, and she's got a 4-year-old son who will be left without a mom. And this was all something that her death at very least could have been postponed for a long time with her illness. But the family waited until they had enough money to go to the private care, and saved up and sacrificed. And all of this was available in the public system. And we didn't know the situation that she was in until it was too late, and we couldn't help her at all. So that's one of those things where, like, it's hard to try to get people out of that mentality. For so many years, if you want your family member to survive, you have to pay a lot of money. And to change that has been difficult. So I don't even know if that answers your question, Josh.
No, that's very important. More important than the question I had.
What was the question?
Well, about blood banking.
Oh, blood bank. Oh, yeah. Now there's blood bank. Now there's blood bank. System. Yeah. Now there's a blood bank. You can get blood. The
Health Ministry or Center?
It's under the Ministry of Health. Ministry of Health used to be Red Cross. Had a blood bank too, and now that's all the Ministry of Health. all centralized there. They set up blood drives to donate for people to donate blood, and it's all free. You don't have to bring anything with you to the hospital now. You don't have to. You can just go and get blood if you need it. Go get your care if you need it. So.
You talked about the Red Cross versus the White Cross yesterday.
Yeah. The Red Cross no longer exists in Nicaragua. That's an organization that lost its legal status in Nicaragua. Their legal status was revoked, and now their properties that they had and their infrastructure belongs to the Ministry of Health under a program called White Cross.
And what was the rationale, briefly, just as a gringo here, just to get...
They didn't comply with the nonprofit laws that exist in Nicaragua.
Okay.
Well, I was going to say, what you just told us about healthcare and the fear of people going to the public institution is the kind of shit that they're trying to teach people in the U.S. right now. And I think, I'm going to be showing this because I think people need to hear this and see what is going to happen if they don't start looking and protecting their healthcare system.
Well, now, I mean...
Can I make a comment on that too? So I think there's an attempt to privatize the VA and to have it all go to private industry, which is a way of not recognizing and moving the direction towards universal health care, which is really what we need. So it's the same dynamic.
And the question that you should be asking in the United States is, if one of the poorest countries in the Western Hemisphere can provide free universal health care for its people at all levels, why can't the richest country in the world?
Amen.
Because we're spending money on weapons.
Yeah.
And
when 47% of your national budget goes to military, in Nicaragua it's 3%.
It's about 53 cents on the dollar.
And in Nicaragua, 56% of our national budget goes to social projects, healthcare and education. And it is 100% political will. Ask anybody, how can Nicaragua have free healthcare? It's political will.
So the question we continually need to ask is, how can we mobilize a people's revolution in the United States? Because what we have is unacceptable. I think most people know that that's the case, but how do we organize the will of the people to move this forward to the next level?
Well, if you look at I think a little thermometer of where the United States stands on this, where the people of the U.S. stand on this, is the reaction to the assassination of the United Healthcare CEO. There was so much positive reaction to that tells us where people stand in terms of their level of frustration with the for-profit medical system in the United States. And this is not, the medical professionals are not to blame for the situation in the United States. It is the government and the insurance companies that are to blame for that. Here in Nicaragua, we still have a private healthcare system. You can pay a bunch of money and go to a private hospital if you want to. That is, you have the right to do that. But increasingly, people don't want to do that. We also have a middle option, which is for people with Social Security. If you have a job, a formal job, and you're paying into Social Security, you have like an HMO system. There are private hospitals that are paid by the government to provide Social Security medicine to working people. And then we have the free public health care system. And those three systems work pretty well together. But the free public system is the best system we have.